Well, there were two issues that came up for me. Both of them related to the acute care nurse practitioner. And in relation to that role, one of the ahas was the vulnerability of the role, given the fact that there are other individuals who, in fact, could be enacting those roles. So, for example, hospitalists or clinical associates, I believe they're called, and now physician assistants. And so I think the aha for me is that it'll be very important for us to identify the value added that the acute care nurse practitioner brings to the role. That we need to come up with a way of credentialing that role. Because right now, many people can call themselves CNSs because they are not regulated. Given that we can't regulate them because they actually function within the scope of RN practice, we need a way of credentialing them. And one of the really exciting opportunities that came up was when Dr. Andrew Padmas mentioned from the Royal College of Physicians and Surgeons in Canada that there might be the potential to partner with the Canadian Nurses Association to spread their credentialing process that is used right now for medicine to various health disciplines, and so that we could partner to meet an important need without having to create an entirely different system. So in terms of the challenges here, I think there are probably three. The first is that we need to showcase both roles. I think it's important for the leaders in Canada, those who are in hospital leader roles or healthcare organizational roles, to learn more about the contribution of each of these roles. And one of the ways that that can be done is to showcase each of the roles individually in the context of the team with which they work, and also sometimes where they work together, the acute care nurse practitioner and the CNS, and how they can meet current patient needs. That'd be one thing. The second thing is to have a national stakeholder meeting, and I'm going to call it National Stakeholder Initiative, 2 phases. The first phase would be related to these healthcare organization leaders, and I'm talking here about the clinical nurse specialist role, to really grapple with the important question of, should we have clinical nurse specialists in Canada? Do they add an important contribution to our healthcare delivery? And then phase 2 of that, assuming that they decide that yes, the CNS role is vital to the Canadian healthcare system and we do need to continue it, that the next phase is to really dig our teeth into some of the critical issues that have to be resolved. And these include, how do we educate CNSs and how do we credential CNSs? To first of all develop the competencies of a CNS. Based on those competencies, develop the corresponding educational program, and then look at how to the certification process for that role. Related to the acute care nurse practitioner, we do need a national dialogue, and this national dialogue will address 3 issues. And what that will address is how we best educate acute care nurse practitioners, because when it comes to acute care nurse practitioners, they have very specialized areas like neonatology or cardiology, neurology, nephrology, and yet we don't need a lot of them in any one province. And so we need to come up with ways to use our faculty resources best and perhaps look at distance education or ways that we can work together across the country to train the acute care nurse practitioners. A serious issue that needs to be addressed is their funding. And that relates to my aha moment earlier, which was that their funding comes from hospitals, and how to ensure that that funding is available. As, for example, right now, some hospitals are receiving incentives, financial incentives, to hire physician assistants. And so that creates a bit of an inequity, makes the scale quite much more in favor of the physician assistant, given that, of course, any hospital will appreciate a financial incentive. And so we need to look at the challenges related to funding this role.